So, we're going to talk about medication management in the athletic training room. This is a chapter in both textbooks, so I strongly recommend that you get familiar with. You read both of them because it's a good read for both of them. Um, but basically, what we're telling you here is, you need to have a policies and procedure manual. Most of these facilities, depending on the state, should be run like healthcare facilities. Many of them are not because they're not state regulated. There are a few that are. But there has to be a tracking system for both over the counter medications as well as dosing packs as well. Because if there is not, all of it falls on the physician, and the physician can get sued for all of it. There should be a separate section for over the counter medicines, different unit packs, as well as prescription meds and control substances as well. Okay. Um, but anything that you could have a team pharmacy. A great place to have a locked cabinets for all these medications would really be in a private exam room that is overseen by the physician. And there are guidelines of who should dispense it, who should administer certain medications, and there's semantics in the words, but there's truth to them. If you are going to give a patient medication, they're going to consume it within the first 24 hours of when you gave them. That's called an administration. If you are giving them medication and they're going to be taking it over a longer period of time, that is dispensing of medication. And we also have these therapeutic dosing packs, like the small travel packs. And those are packed and they are given within certain timelines and rules and regulations. Okay. And if we're doing a therapeutic intervention, it has to be applied or injected in the athletic training room. That would be a direct administration of it. But the Drug Enforcement Administration, okay, these places need to be registered. And every place where a physician has medication that is locked up, they have to register with the DEA. And so some physicians may have multiple facilities because they're out of state or multiple places. They must have a DEA for each location. So a school physician for many schools would have one in different places. Okay. Um, and you must have a license for where medication is going to be stored and dispensed. Okay. Um, but all prescription orders need to be in the name of the physician. The physician needs to give authorization of who can be touching and dispensing medication. There should be a very tight inventory of who's dispensing, who is taking medication, who is giving it to whom. And, if there's going to be those discretionary decisions where it goes under the purview of the athletic trainer by means of the physician, that needs to be written out as well. So things that you need authorization for, right? If we give ionto and phonophoresis, which is things that we talk about, okay, it has to be prescribed to that person. It needs to be stored appropriately in a safety way. It could only be administered to that person, and there must be treatments of how much to whom on what dates. Okay. If the athletic trainer is picking medications up, it has to have authorization who's going to pick up and what are they going to do it and where are they going to store it. Again, there needs to be a protocol for it. And anytime you're storing it, it needs to be in a locked cabinet where who can access it, as well as who can also keep emergency medications. Okay. And really, what it's there for is to keep everybody safe. Now, I think I told you there are some states that you are run like a healthcare facility and have stringent laws. Whichever one, state or federal, whichever one has the most stringent law, that's the law of the letter that we follow. Here, it's an illegal for the athletic trainer to dispense medication. That is very true. Okay. Again, it all falls underneath the physician. You always need to have a licensed personnel. Okay. There's those discretionary and then the non-discretionary. Discretionary is by licensed personnel. Diagnosis, prescribing, administer, dispensing. Again, with that conversation with with the overseeing physicians. And again, there should be a policies procedure current that everybody signs off on who can dispense, who can get underneath whose name, where's it stored, and who is doing inventory on a regular basis. Anytime that there's expired medications, okay, not only do you need to remove it, but you need to record which ones are expired and when they're given away. You do not flush them. They go to biohazard waste to be um, dispensed in that way. They do not get flushed. Okay. So even if the thing's going to be refrigerated, the refrigerator must be locked so that nobody else can get it. Okay. There could be an audit that should be looked at every 3 years. And if you do get audited, you need to keep it. You need to have copies of all licenses of all the pharmacies, waste disposal companies, physicians, prescriptions, inventory records, okay, and all reconciliations that you do at the end of the year, as well as any type of signage, okay. And if you are going to do this, I'm going to tell you again, it should all be done in the same physician room, okay. So DEA requires if you're going to have a controlled substance, it has to be away from other prescription medications. There also needs to be inventory, okay, and if there's any registrations and records. If you are traveling, okay, it's going to be different going state to state or internationally, okay? But the team physician is the bottom line person. But again, this should be under policies, procedures on where's it being locked, whose suitcase is it going into, who's going to be carrying it, and it must be secure at all times. So, a very tight policies procedure manual is something that is absolute must in outlining medication management.